Welcome, everyone. I'm excited to kick off today's session with a focus on comprehensive airway management in respiratory therapy. Today's presentation is titled Techniques, Devices, and Clinical Practices for Ensuring Airway Patency and Patient Safety. Over the next few minutes, we'll explore key strategies and tools to help you optimize airway management and improve patient outcomes. So let's get started. Let's take a moment to look at the overview of airway management. As respiratory therapists, our goal is to ensure that patients can breathe effectively. Proper airway management is all about providing adequate ventilation and oxygenation, which are essential for patient stability. When we manage the airway well, we can prevent many complications that might arise from airway obstruction or inadequate breathing. This brings us to the importance of effective airway management. It's a critical part of our role because maintaining airway patency directly impacts patient safety. Whether we're performing a routine procedure or responding to an emergency, our efforts help keep the airway open and functional. Now, speaking of our roles, respiratory therapists are key players in this process. We're trained to assess, secure, and manage airways in diverse clinical situations. Our expertise helps ensure that patients maintain proper oxygen levels and ventilation at all times, especially during critical moments. Finally, this chapter, Chapter 37, Part 3, zeroes in on airway management. It emphasizes just how vital this aspect is within respiratory therapy. Understanding and mastering airway management techniques is fundamental to providing comprehensive care and ensuring positive patient outcomes. Let's go over some of the key responsibilities involved in airway maintenance, which is a crucial part of comprehensive respiratory therapy. First, providing appropriate cuff care is essential. This helps prevent injuries and reduces the risk of aspiration, which can lead to serious complications. Next, aiding in secretion clearance is vital for keeping the airway clear. Using closed suction systems and bronchial hygiene techniques, we can effectively remove secretions while minimizing patient discomfort and infection risk. Preventing nosocomial infections is another critical aspect. Strict hand hygiene and careful care practices help reduce the chances of hospital-acquired infections, safeguarding both the patient and healthcare staff. Ensuring adequate humidification is also important. When the upper airway is bypassed, the natural humidification process is lost, so we need to provide humidification to keep the airway moist and prevent drying or irritation. Facilitating patient communication is often overlooked but incredibly important. Even with an airway device in place, we should find ways to help patients communicate effectively, which can significantly improve their comfort and cooperation. Finally, securing the airway tube and maintaining proper placement is fundamental. This prevents accidental dislodgement and ensures the airway remains patent and safe for the patient. All these responsibilities work together to ensure safe, effective, and comfortable airway management, which is at the heart of our overall respiratory therapy goals. Now, let's talk about the importance of properly securing airway devices to prevent displacement and maintain airway integrity. When it comes to tracheostomy tubes, or TT, they are typically secured with cloth ties or special commercial holders that often feature Velcro. These securements are designed to keep the tube in place securely and comfortably for the patient. Similarly, endotracheal tubes, or ETT, are stabilized using cloth tape or commercial tube holder devices that are specifically designed for this purpose. Proper securing is critical because it not only prevents accidental dislodgement, but also helps avoid complications like airway trauma or loss of the airway. So, ensuring these devices are properly secured is a fundamental part of comprehensive airway management in respiratory therapy. It's a simple step, but it plays a huge role in patient safety and effective treatment. Let's talk about speaking valves, which are specifically designed to help patients with tracheostomies. These valves play a crucial role in restoring some level of speech functionality, allowing patients to communicate more effectively. In addition to speaking valves, patients can also write messages or use tools like letter, phrase, or picture boards. These nonverbal communication tools are incredibly helpful in conveying information when speech isn't possible. Caregivers also play an important role by assisting patients with lip reading, which involves interpreting lip movements. This method helps bridge the communication gap and makes interactions smoother. Now, when it comes to standard tracheostomy tubes, they typically allow the vocal cords to move, but they block airflow, which limits the patient's ability to speak clearly. So, while the vocal cords can move, the airflow needed for speech is restricted. In contrast, endotracheal tubes prevent vocal cord movement altogether and block airflow entirely. This means patients can't produce phonation, making communication even more challenging. Understanding these differences and tools is essential in comprehensive airway management, as it directly impacts patient communication and quality of life. Ensuring proper humidification and infection control is absolutely crucial when managing artificial airways. As we focus on infection prevention, it's important to remember that applying bronchial hygiene techniques helps maintain airway patency and prevent complications. Using closed suction systems is a key part of this, as they significantly reduce the risk of contamination and infection spread. Additionally, secretion clearance techniques are vital. Regularly and rigorously practicing hand hygiene between patient contacts is one of the most effective ways to minimize nosocomial infections. Now, because artificial tracheal airways bypass the upper airway's natural functions, like humidification, filtration, and heating, humidification becomes essential. Without it, the airway and lungs can dry out, leading to discomfort and potential complications. So, in summary, maintaining a sterile environment and ensuring proper humidification are fundamental to safe and effective respiratory therapy. These measures not only protect the patient, but also support overall treatment success. Let's talk about cuff pressure care and how it relates to preventing silent aspiration. Current cuffs, unfortunately, can develop channels that allow oral secretions to bypass them. This means that even if the cuff appears to be secure, secretions can still leak past, increasing the risk of silent aspiration, which is a serious concern. To minimize this risk, it's essential to regularly check cuff pressures. However, avoid manual methods like MOV and MLT because they can actually increase the chance of aspiration. Instead, use proper cuff pressure monitoring techniques. The optimal cuff pressure range is typically between 20 and 30 centimeters of water. Keeping pressures within this range ensures that the cuff seals effectively without causing damage to the tracheal mucosa. It's important because pressures too high can cause injury, while pressures too low may not prevent secretions from leaking. When selecting cuffs, high-volume, low-pressure cuffs are recommended. These cuffs distribute pressure more evenly, reducing the risk of tracheal injury and improving safety. Overall, proper cuff management is crucial. It helps prevent not only aspiration, but also tracheal injury, ensuring better patient outcomes and safer respiratory therapy. Let's look at this case study to understand some common airway cuff problems. We have a 220-pound, 6'2" male patient who was intubated with a 7 endotracheal tube. Over time, he started experiencing increasing difficulty maintaining the cuff seal. This is a key point because a proper cuff seal is essential to ensure effective ventilation and prevent aspiration. The nurse reports that they needed to add more air to the cuff to prevent leakage, but importantly, cuff pressures had not been monitored. This highlights a critical oversight. Without regular monitoring, cuff issues can go unnoticed and lead to complications. In observing the situation, it was noted that the tube was actually undersized for this patient. To compensate, overinflation of the cuff was necessary, which unfortunately increases the risk of tracheal injury. Overinflation can cause tissue damage, so it's not an ideal solution. The likely problem here is that the tube itself was too small for this patient's airway. The best course of action would be to replace it with a larger diameter tube. This would allow for an effective seal at safe cuff pressures, reducing the need for overinflation and lowering injury risk. This case underscores the importance of regular cuff pressure monitoring as a preventive measure. Consistent checks help ensure cuff pressures stay within safe limits, preventing issues like leaks and tissue damage. Overall, this reminds us that proper sizing and vigilant pressure management are key components of comprehensive airway management in respiratory therapy. When it comes to airway emergencies, immediate intervention is absolutely crucial. Acting quickly can make the difference between a smooth recovery and serious complications. That's why recognizing these emergencies early and responding promptly is so important for patient safety. A key warning sign to watch for is if there's air movement through the mouth or nose despite ventilation efforts. This suggests there might be a problem with the airway or the ventilation system itself and needs to be addressed right away. Decreased breath sounds are another critical indicator. If you notice this, it could mean there's an airway obstruction or some other issue that needs urgent attention. Respiratory distress is also a major sign of airway trouble. It's something we have to recognize immediately so we can intervene and ensure the patient's safety. Finally, be aware of common airway emergencies like tube obstruction, cuff leaks, or unplanned extubation. These are situations that require swift action to prevent deterioration. Overall, quick recognition and response are key to managing these emergencies effectively. Now, let's discuss some common causes of tube obstruction and how we can address them effectively. One key solution is to use mucus shaving devices, which are helpful in clearing thick, tenacious secretions that can block the airway tube. These devices help ensure the airway remains patent and reduce the risk of respiratory compromise. Another important point is repositioning the patient's head and neck, or adjusting the tube placement itself. Sometimes, the obstruction occurs because of tube malalignment or against the tracheal wall, which can be relieved simply by repositioning to improve airflow. Suctioning the tube is also vital when there's mucus plugging. Remember, always use sterile techniques to prevent infection. If necessary, saline can be used to loosen thick secretions before suctioning. We should also be aware of kinking or biting of the tube, which can cause partial or complete obstruction. Ensuring the tube isn't kinked and that the patient isn't biting it, using bite blocks if needed, can significantly reduce these issues. Overall, understanding these causes and applying the appropriate solutions ensures we maintain a clear airway and support our patients' respiratory health effectively. Let's talk about cuff leak management, a crucial part of comprehensive airway management in respiratory therapy. When we encounter a damaged cuff, it's essential to act quickly to prevent ventilation failure. The first step is to identify the source of the leak, which involves examining the pilot balloon, the line, and the valve for any signs of damage or leaks. Once you've pinpointed the problem, the next step is to repair the pilot valve, ideally using a pilot valve repair kit. This allows you to replace the valve safely without removing the entire endotracheal tube, saving time and reducing patient risk. If the cuff is ruptured and cannot be repaired easily, you need to address the situation promptly. This might mean performing an extubation and reintubation, or in some cases, using an endotracheal tube exchanger to replace the damaged tube quickly. The key takeaway here is to ensure timely action, repair or replace damaged components promptly to maintain effective ventilation and prevent complications. This process highlights the importance of being prepared and knowing the right steps to take in cuff leak management, all of which contribute to the overall goal of safe and effective airway management in respiratory therapy. Let's discuss how to recognize and respond to unplanned extubation, which is a critical aspect of comprehensive airway management in respiratory therapy. First, if an unplanned extubation occurs, it's essential to prepare for prompt reintubation or consider reinsertion of a tracheostomy tube to maintain the patient's airway. Time is of the essence here to ensure the patient continues to breathe effectively. Next, you'll want to be ready to provide manual ventilation using a bag valve mask. This step helps support the patient's breathing immediately after extubation, maintaining oxygenation and ventilation. If necessary, deflate the cuff of the tube to facilitate manual ventilation and reduce resistance. In cases where the tube is displaced or completely out, the immediate action should be to remove the tube entirely. This prevents further airway obstruction and prepares for reestablishment of the airway. Now, recognizing signs of unplanned extubation is crucial. Some key indicators include decreased breath sounds and reduced airflow through the tube, which suggests the tube may no longer be in the correct position. You might also notice difficulty passing a suction catheter beyond the tube end, indicating partial or complete dislodgement. Additionally, if you hear audible airflow through the mouth, nose, or stomach during positive pressure ventilation, these are signs that the airway is compromised or that the tube has been displaced. Being vigilant about these signs allows for rapid assessment and appropriate action, ensuring patient safety and effective airway management. Now, let's discuss the extubation and decannulation process, which is a critical part of comprehensive airway management in respiratory therapy. Careful assessment is absolutely crucial here to ensure that removing artificial airways is safe for the patient. One of the most important steps is confirming upper airway patency. That means making sure the airway is clear and open enough for the patient to breathe on their own. This step is vital because if the airway isn't patent, removing the artificial airway could lead to airway obstruction or other complications. Additionally, we need to verify that the original airway problem has been resolved. If the underlying issue persists, removing the airway device might be premature and unsafe. Assessing readiness involves several key factors. First, checking that the initial airway problem has been addressed. Second, evaluating the quantity and consistency of secretions, because excessive or thick secretions can hinder successful removal. Third, confirming upper airway patency. Fourth, ensuring the patient has an intact gag reflex, which indicates protective airway reflexes are functioning. And finally, assessing their ability to clear airway secretions effectively. Now, to clarify the terminology, decannulation refers specifically to the removal of a tracheostomy tube, while extubation, on the other hand, means removing an endotracheal tube. Both procedures require careful evaluation and timing to ensure safe and successful airway management, which ties back to our overall goal of maintaining patient safety throughout respiratory therapy. All right, let's walk through the extubation step by step to ensure we do this safely and effectively. First, we need to prepare the equipment. This includes gathering all the necessary tools like the intubation set and making sure oxygen therapy is ready to go on standby. It's important to be fully prepared before we start. Next, we perform suctioning. We'll carefully suction the endotracheal tube and the pharynx above the cuff to clear any secretions. This helps reduce the risk of aspiration or obstruction during extubation. After suctioning, the next step is to oxygenate the patient. We give 100% oxygen for about 5 minutes. This helps ensure the patient is well oxygenated and ready for the tube removal process. Now it's time to deflate the cuff completely using a syringe. Once deflated, we perform a leak test by listening for a leak around the tube. If there's no leak, it indicates swelling or obstruction, and we should not remove the tube yet. Ensuring a leak exists is crucial for a safe extubation. Finally, at the peak of inspiration, we remove the tube. It's important to expect some coughing afterward, as this is a normal reflex. Coughing helps clear the airway, but we need to be prepared for any potential complications. By following these steps carefully, we help ensure a safe transition from mechanical ventilation to spontaneous breathing. Now, let's look at the decannulation and weaning process, which is a crucial part of comprehensive airway management in respiratory therapy. First, we have the use of tracheostomy buttons. These devices help us maintain the stoma while allowing the airway to close naturally when appropriate. Next, we move to progressive tube downsizing, where we gradually reduce the size of the tracheostomy tubes. This encourages the patient's own breathing efforts while still providing airway support. Finally, we utilize fenestrated tubes that have openings above the cuff. These are designed to increase upper airway use, helping the patient transition more smoothly to breathing without assistance. Together, these steps form a systematic approach to safely wean patients from tracheostomy dependence, always prioritizing their comfort and airway stability. Let's take a closer look at some specialized airway devices. These tools, including subglottic suction tubes, lighted wand stylets, bougies, and video-assisted intubation devices, are designed to meet specific clinical needs. They help us manage difficult airways more effectively and improve patient safety. Moving on, there's the double-lumen endotracheal tube, which plays a crucial role in independent lung ventilation. This device allows us to ventilate each lung separately, which is essential in certain surgical procedures or lung isolation scenarios. We also have advanced airway options like the Combitube and King Airway. These are used in more complex airway situations where standard intubation might not be feasible. They provide reliable airway control in emergencies and challenging cases. The double-lumen airway devices, in particular, are key tools in specialized airway management because they give us greater flexibility and control when ventilating patients with complex needs. Finally, beyond the standard endotracheal tubes, devices like the laryngeal mask airway, or LMA, have expanded our options. These specialized devices help us secure the airway quickly and effectively, especially in cases where traditional methods are difficult or impossible. Overall, these specialized airway devices are integral to comprehensive respiratory therapy, enabling us to tailor our approach to each patient's unique situation and ensuring safe, effective airway management. Now, let's discuss some important limitations of the laryngeal mask airway, or LMA. First, it does not protect against aspiration if regurgitation occurs, so we need to be cautious in patients at risk of stomach contents coming back up. Another key point is that it can't be used in conscious or semi-conscious patients because it can stimulate the gag reflex, which could cause additional complications. Moving on to the ventilation mechanism, the LMA creates a seal in the oropharynx that directs air into the lungs. However, we have to be mindful that if ventilation pressures exceed about 20 centimeters of water, there's a risk of gastric distension, which can lead to other issues like vomiting or aspiration. It's also worth noting that the LMA comes in a variety of sizes, suitable for everything from infants to adults, making it a versatile tool in airway management. Finally, let's quickly review the structure. The LMA consists of a short tube attached to a small cuffed mask that is inserted into the oropharynx. The open part of the mask faces the laryngeal opening, and the tip rests just above the esophageal sphincter. This design helps facilitate effective ventilation while minimizing trauma. Understanding these limitations and structural details helps us use the LMA safely and effectively as part of comprehensive airway management. Let's take a closer look at the double-lumen airway, also known as the Combitube. This device is particularly useful in emergency airway management situations where quick and reliable airway access is critical. One of its key advantages is that it allows for ventilation regardless of whether it's properly positioned, making it a versatile tool in urgent scenarios. The Combitube features a dual-lumen design, which means it has two separate channels and two cuffs. One cuff is designed to seal the oropharynx, helping to secure the airway, while the other cuff seals either the trachea or the esophagus, depending on placement. This dual-cuff approach ensures a better seal and more effective ventilation. Externally, the device has two openings and standard 15 adapters, making it compatible with typical breathing circuits. The design is specifically intended for blind insertion, meaning it can be placed without direct visualization, through the oropharynx into the trachea or esophagus. Overall, the Combitube is a valuable tool because it simplifies airway management in emergency settings, providing a reliable means to ventilate patients quickly and effectively, even when traditional methods might be challenging. Let's take a closer look at the King Airway and the double-lumen ET tube. These devices are essential tools in comprehensive airway management within respiratory therapy. On this slide, you'll notice that the double-lumen endotracheal tube contains two tubes in one. Each of these tubes has a cuff that seals a bronchial lumen, which is key for isolating each lung. This setup allows for independent lung ventilation, which is especially critical when dealing with unilateral lung disease. It helps prevent cross-contamination and ensures targeted ventilation. Additionally, these tubes feature both proximal and distal cuffs. The proximal cuff isolates the laryngopharynx from the esophagus and oropharynx, helping to secure the airway and prevent leaks. The distal cuff, meanwhile, isolates the bronchial tree, allowing for more precise control of ventilation. When comparing the King airway and the double-lumen ET tube, it's important to understand their roles in airway management. The King airway is a supraglottic device, easier to insert and useful in emergency situations. The double-lumen ET tube, on the other hand, provides more specialized control for lung isolation during surgeries or in severe unilateral lung conditions. Both tools exemplify the advances in airway management that enable us to tailor ventilation strategies to the patient's specific needs, ultimately improving outcomes. Now, let's take a closer look at some other special airway equipment that plays a crucial role in comprehensive airway management in respiratory therapy. These tools are designed to improve visualization of the airway during tube placement, which is key to increasing safety and ensuring success. First, we have video-assisted intubation tools. These involve thin plastic rods that are passed into the trachea, giving us a clear visual of the airway on a screen. This technology is especially helpful in challenging airway management scenarios where traditional methods might be difficult. Next, there are bougies, which are used for difficult intubations. They utilize transillumination to help guide the tube into the trachea. This technique significantly improves our success rate when dealing with tricky airways. Then, we have lighted wand stylets. These are specialized devices that help us visualize the airway during intubation by providing illumination from within the tube. Their use enhances safety by making the tube placement more accurate. Finally, subglottic suction endotracheal tubes are equipped with special ports that allow us to remove secretions above the cuff. This feature helps prevent complications like ventilator-associated pneumonia and keeps the airway clear, contributing to overall better patient safety. All of these tools are integral parts of a comprehensive approach to airway management, helping us achieve safer, more effective interventions for our patients. Now, let's take a closer look at some of the challenges we face with difficult intubations and how we assess airway management. On this slide, we focus on the Mallampati score classification, which is an important tool to predict potential difficulties before attempting intubation. It works by evaluating the oral anatomy, specifically, how much of the oropharynx is visible when the patient opens their mouth. A higher Mallampati score can indicate a potentially more difficult airway. Moving on, it's useful to understand the scope of this issue. Each year, in the United States alone, there are about 1 million difficult intubations. That's a significant number, considering there are roughly 20 million intubations performed annually across the country. And while most intubations go smoothly, approximately 5% are classified as difficult. That means, out of every 100 intubations, about 5 can present challenges. Recognizing these statistics helps us appreciate the importance of thorough assessment and preparation. Overall, these points reinforce the need for us to be vigilant and well-prepared in airway management, ensuring patient safety and successful outcomes.